Good morning, my name's Dr. Jeremy McAnulty from New South Wales Health, and I'm here with a COVID update for New South Wales for Friday the 10th of December 2021. In the 24 hours to 8 o'clock last night, there were 516 COVID-19 cases reported in New South Wales, and there were more than 90,000 tests reported in the same period. In terms of Omicron, there are a total of 42 cases of Omicron now identified in New South Wales. 13 of these cases were acquired overseas or on an international flight, and the other 29 were locally acquired. There were no new cases confirmed with the Omicron variant of concern overnight. In terms of hospitalisations, there are currently 158 COVID-19 cases admitted to hospital, with 24 people in intensive care, 9 of whom require ventilation. To date, there have been no cases of Omicron admitted to hospital in New South Wales. In terms of vaccination, across New South Wales, 94.7% of people aged 16 years and over have received their first dose of vaccine, and 93% are now fully vaccinated. Of people aged 12 to 15 years of age, 81.4% have received one dose, and 77.5% are fully vaccinated. In terms of sewage, our ongoing sewage surveillance program to detect fragments of the virus that causes COVID has been identified in a number of communities: Galarganbone, Eden, Maria, Tomakan and Narandra, where there have been no recent known cases. So everyone in these communities, if you have even the mildest of symptoms, please come forward for testing right away so we can detect whether or not you might have COVID. As Christmas approaches, and more of us gather with families, friends and colleagues to celebrate, we all need to be really vigilant to protect ourselves against and our friends against COVID. Following the identification of a case of COVID at Noah's Backpackers Bondi, testing was conducted on site on Thursday evening. Approximately 90 residents have been asked to isolate in their rooms in line with isolation requirements. At this time, Omicron is not suspected. New South Wales Health is also concerned about the increased transmission taking place in venues such as pubs, clubs and party settings. This includes recent outbreaks associated with venues such as the Golden Sheaf Hotel at Double Bay, Oxford Tavern at Petersham and the Albion Hotel in Parramatta. The transmission in these types of settings is contributing to the increase in cases in New South Wales, and we urge people not to attend any of these social functions or venues if you have any symptoms at all, even if mild. If you don't have any symptoms, rat testing can be used if you want to make sure and take extra precautions. Please look at our website, New South Wales Health website, on how rat testing can be used in these circumstances. New South Wales Health also strongly encourages people to wear a mask in situations where you can't physically distance, especially indoors. Getting together outdoors for group celebrations where you can is a good idea. If celebrating indoors, choose large, well-ventilated spaces with open doors and windows. The emergence of the Omicron variant is a timely reminder of the importance of booster shots in maintaining a high level of protection against COVID in the community. New South Wales vaccination hubs are well placed with ample supplies of vaccines for anticipated increase in demand for booster doses when large numbers of the community become eligible for vaccine boosters between January and April 2022. New South Wales Health continues to work closely and collaboratively with the GP networks and pharmacies and local communities to ensure booster doses are available for all eligible people. Anyone eligible for booster doses can book up to 60 days in advance at a New South Wales Health vaccination clinic through the New South Wales Government website. So thanks again for everyone for coming forward for getting tested if you have even the mildest of symptoms, making sure you're fully vaccinated with boosters when they're due, and taking those extra precautions to keep us all safe over this coming festive season with social distancing, using masks, good hand hygiene, and importantly, not attending venues or parties if you have even the mildest of symptoms. Thanks again.